Well, thank you all. A report on today's action by the White House Coronavirus Task Force. The President and our entire team continue to be inspired by the way people all across this country are putting into practice 15 days to slow the spread. We are 10 days into the 15 days. And let me say again to every American, if you're in an area that's been impacted by the coronavirus, it's absolutely essential that you listen to state and local authorities for guidance. But for every American, what you can do is implement the practices outlined in the President's coronavirus guidelines today. Because we truly do believe that, as millions of Americans have done and will continue to do, that we can significantly impact the rate of growth in this epidemic in our country. We can spare Americans from exposure to the coronavirus, and we can save lives. And so on behalf of the President and our entire task force, I want to say thank you to the American people. And thank you for your cooperation. Thank you for embracing the principles in 15 days to slow the spread. We heard about that cooperation today in a series of conference calls. We spoke with equipment manufacturers who are stepping forward as never before to assist us in developing the medical equipment that is essential, whether it be masks or other medical supplies or ventilators. FEMA reported to our task force today that hundreds of companies have stepped forward to be involved in the supply chain, and we are vetting nearly 70 of those countries for specific repurposing of their manufacturing to produce everything from masks to gloves to gowns and, of course, to ventilators. We also had a very productive call with Secretary Betsy DeVos with education leaders from around the country today. And let me say on behalf of the President and a grateful nation, thank you to all of our teachers, many of whom are now home, teaching children from afar, even in many cases while they have their own kids home from school. You are truly heroes, and the Department of Education, as well as your State Department of Education, are grateful to each and every one of you who find yourselves educating out of home. And the Department of Education has a helpful website on coronavirus recommendations, ed.gov/coronavirus. And as we mentioned before, Secretary Betsy DeVos and Secretary Sonny Perdue will be joining us at this podium on Friday to speak about distance learning recommendations that have been made not just for secondary or for college education, but also for K through 12 education. We're opening up avenues, creating new flexibility so that not only college students can continue to be involved in learning from afar, but children K through 12 can do the same. Secretary Perdue will also be here to talk about the food lunch program and free and reduced lunches. Today, the President and I also spoke to over 150 CEOs of the top nonprofit organizations in the country. We thanked them for their ongoing work, supplying the needs not only of people impacted by the coronavirus, but the most vulnerable among us in our communities. Organizations like Red Cross, the Salvation Army, Feeding America are all still working every day. And we promise to urge every American, if you have the means and have the ability, continue to be generous to nonprofit organizations that are helping those most in need in your community. The President marshaled a whole of government approach. That means working with our governors today. The President and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states, and the President and I are truly grateful. The task force made a recommendation, and FEMA has assembled a team to provide technical assistance to the state of New York, and that team was welcomed by Governor Cuomo. Will be arriving on the ground there very soon, along with all the other resources that the President recently announced would be flowing to New York and to Washington State and to California. In my conversation with Governor Gavin Newsom of California, I was pleased to speak to him and hear that our FEMA team is literally at the table with the state of California's team working to meet their supply needs, working to work on capacity. And I want people to know in the states that are most impacted by the coronavirus that we are with you. We're going to stay with you. We're going to continue to work around the clock to make sure your courageous healthcare workers, your health systems, and your state governments have the resources to support your response. On the subject of testing, Dr. Birx will reflect on what the data is showing in just a moment. Not including local labs and hospitals, we are at 432,000 tests completed. And we're pleased to see that there are literally drive-through and community sites around the country, and the U.S. Public Health Service is assisting states in standing those up each and every day. We do remind hospitals and labs around the country, and the moment the President signs the bill, that it is absolutely essential that they provide the results of the test to us. It gives us visibility into what's happening on the ground. But because of the public-private partnership President Trump initiated with these vast commercial lab networks around the country, we are adding tens of thousands of tests every single day. On the subject of supplies, before the end of the week, we'll talk a bit more, as the President did moments ago, about the supply chain. I was at FEMA last night and literally saw a room full of people with laptops and cell phones. We are literally leaving no stone unturned, as I told governors today, to find medical supplies, whether it be masks or gowns or gloves or ventilators, and the team is working around the clock to meet those needs. A few smaller items. First and foremost, the CDC is developing guidance, which we'll be publishing tomorrow, about the best way to utilize our natural resources at our parks. It would be several weeks ago that our Park Service waived all entrance fees, and we directed the CDC to produce guidance for how people can still practice social distancing and common sense, but be out of doors and enjoy our natural parks. We'll also be sharing that guidance with the vast state park systems around the country and encouraging their support. With that, let me last say again, there's nothing more important for the American people to do to slow the spread than to heed your state and local guidance in areas impacted by the coronavirus, and for everyone else to put into practice the 15 days to slow the spread. Dr. Fauci will reflect on the importance of mitigation and the impact that we believe that it is having around the country. People ask me from time to time, what can I do? And I say from my heart to every American, this is what you can do. Not just to protect your own health and that of your family, but no American wants to inadvertently spread the coronavirus, particularly to those that may be vulnerable to serious health consequences. Remember that the risk of serious illness to the average American remains low. I mean, the vast majority of people that contract the coronavirus will have mild symptoms to flu-like symptoms and will recover. But for seniors with serious underlying health conditions or with people with immunodeficiencies, everyone needs to practice the principles of 15 days to slow the spread. The President announced this week that we are looking forward to the day that we can open up the country. And this team will be bringing him recommendations about how we can safely and responsibly do just that. But for every American that wants to see America back in business, you can hasten the day by putting into practice the 15 days to slow the spread. Go to coronavirus.gov for details. And I truly do believe if all of us will do all that we can do, we will slow the spread, we will protect the most vulnerable, and we will heal our land. With that, let me recognize Dr. Tony Fauci to speak about